Good morning, everyone. Welcome to the Latte Wellness Group. We're doing our discussion today on the use of AI, artificial chatbots in mental health. We brought in a team I'll have the team. I have Chinadu introduce him and his team, but for the new team members, we are the Latte Wellness Group, mental health clinic, private practice, and life coaching. We have offices in Maryland, Virginia, DC, and throughout the states, and some overseas offices as well. And last week I met with Chinadu and his team in regards to they have an exciting new project that they're working on, chatbot for mental health. And so I thought it'd be interesting discussion for us to see it in action, and also discuss the risk, the ethical risks, security risk, all of the things that I know that we got to consider if we decide to move forward. Any questions before we get started? All right. So Tim, I'll hand it over to you. Tell us, give us that opening pitch. Like tell us about your team, the problem, all that stuff. Give us a good intro so the team will know.
Hello, everyone. Nice to meet you. Sorry, my camera is off. I've been having some camera problems for a while. So my name is Chijindu. I'm the founder of mhapy. I'm here with Theophilos and Kelvin. They're part of my team. What we do is we have built a chatbot for mental health assessments. So I work as a mental health nurse myself, and I realized that I was spending time, giving assessments to patients. I also saw that, when I'm dealing with people on an outpatient basis, I see them once in 2 weeks. Sometimes you give them assignments to do at home. Sometimes you tell them to take the GAD-7, the PHQ-9, and maybe they forget, maybe they don't do it. If there have been other questionnaire-like solutions that have been thought of and given to patients or clients to try out, and because questionnaires are not engaging, they miss that they don't have that human component. People are not able to keep up with them. And so what we've built is a mental health chatbot, a chatbot that can talk about mental health issues, can explain symptoms. You can connect them with your therapist. They can send an email to their therapist. The therapist gets notifications on how the person is doing. The therapist can see, the trends in the person's data over time. So if the person talks with the chatbot over time, the therapist can go on the back end and see the levels of anxiety, the levels of depression, and any other mental health symptoms that the therapist is working on. So this empowers you with information. It's measurement-based care. If your interventions are working. If a person started seeing you 2 months ago, and you can see maybe they started seeing you for anxiety, you can see that the anxiety levels have actually dropped over time. You can see the trends. That's helpful for you. If you see that it hasn't dropped over time, or perhaps there's a pattern there, and there's a particular day of the week, there's a particular time when their levels peak, you can identify these patterns and re-strategize and work to deal with these things. So that's what we're doing in a nutshell, and I'm happy to talk to you guys today.
Gotcha. Thank you. You have a demo for us?
Sure. So I'm going to share my screen. Give a second.
And while you're doing that, I'm gonna open it up to the team here to see if they have any questions before we go into the demo. Any questions?
All right. Sure. Yeah.
I do have a question. So I'm kind of just listening to you explain it. So is this sort of thing, it's not really meant to like replace therapists, but it's really supposed to like serve as an agent to help and maybe keep up with maintenance?
Yes. So we call it a virtual assistant for therapists. So it helps you, you assign assignments, for instance, can give them reminders. It can talk to them about the issues. And it's a way for you to collect information on your clients over time, because you're not going to see them every day. You're only going to see them 1 hour in a week or 1 hour in 2 weeks, whatever you're doing. So it just gives you real-time, continuous information that you can look up at any time you want.
Okay, great. Thank you.
Yeah. All right. So this is how our first phase of the pilot has gone. We've launched with a few practices where they just get a chatbot on their websites like this. So that's how we reduce Kairos, the same thing. But this is a small demo of the chatbot. It's a chatbot that you can talk to. You can say anything you want. Is there something somebody wants to say? Is there something that a client has said that maybe you want to respond to or something like that? So,
Well, I have a client that, like, if let's say a client texts, I'm feeling worthless today.
let's see. Feeling worthless. Oh, just gonna say it again. Sorry. It says that's not true. Everyone has something to offer, and you have unique gifts and talents that make you valuable. What can you do today to focus on your strengths instead of your weaknesses? No, I don't think I have any strengths. That's okay, everyone. So it's able to have conversations about any issues. And the whole idea is that it's gonna, through these conversations, because when I work as a mental health nurse, I'm having conversations with a person, but through these conversations, I'm trying to have an assessment of their mental health, trying to say, how are they doing today at the end of the day? And I do this in my mind, by filling out these validated skills that I have to go fill out at the end of the day. So it says that's okay. Everyone has their own unique strengths and weaknesses. It might help to think about what you're good at, what you enjoy doing. They give you a better idea of your strengths. What do I enjoy doing? Okay, I don't enjoy doing anything. Let's see. It's okay. There's still plenty. Anyway, so that's the general gist of what's going on. So at the end of the day, say I need help. What can I do to help? I say hello. So the chatbot, it collects the person's information. This is their email address. The reason this is collecting their email address is just because this is a web application that people have just coming on. But if they were using the mobile app, they would have already given their email address already. So we'll not have to collect it again. Chris. Oh. This is just a fake email I use. My name is Chris. Have I been diagnosed with any mental health conditions? No. What's it related to? No. So mood. Say I'm depressed. So it asks me to do the PHQ-9. I can skip it. I can choose to do it. So it asks me questions. Do I have little pleasure in doing things? The general assessment questionnaires that we have. I can also say, see if that works. If it's connected to this, I want to talk to my therapist. It says, should I send an email to your therapist for you? Something like that. Yeah. So that's the general idea. At the end of the day, maybe Kelvin can share, what the therapist looking face will look like.
Nice meeting everyone. Okay, so this is the dashboard for the therapist. As a therapist, once you come into the web application, the first thing you need to do is to probably just register an account.
Yes, Rita.
No, I wasn't saying nothing. I'm sorry.
Okay.
Okay, registration was successful. I'm just going to log in right now. All right. So as a therapist, after a registration has been successful, this is a dashboard for a therapist, and anyone who uses the widgets, that's the chatbot, uses the chatbots, he or she, the client is just going to appear here as part of the prospective client. That's for the very first time whenever they use the chatbots. When Chijendu was presenting, as you could see, they had to input their first name and also their email address. So they will all appear here as prospective clients. And after they have gone through the entire process, they will be assigned as clients. So I think Theo, we have to add my account as a client now. So
Okay, so I just added you. Maybe just refresh your screen. See if that works.
Theo, are you here?
Is Theophilus there?
Yeah, yeah. So
So
what
add Kelvin as a client. Let's label Kelvin as your therapist, so they can see your backend.
oh, okay. So
Maybe share your screen as you do that. Oh, you can.
yeah, so I'm going to do that on my mobile because I use the mobile application. So that's
In the meantime, okay. In the meantime, I can just show you what it looks like from the client's perspective. So I'll just share my screen while Theophilus does that.
yeah, so I'm done adding Calvin as my therapist.
Well, let's just wait. Once I'll show them what it looks like from the client's perspective. So I just opened because I have an emulator here. I can open it on my phone. So the app will look like this on the client's phone. They can talk to the chatbot here. See, I don't know. I'm in pain. Am I on any medications? No, I am on medications. Okay, and they can check their own analytics here. You can see all the forms that they have filled. They can check their own, GAT7 and their own analytics here. Kelvin, are you ready?
Yes, I am.
All right. So I'll just let you go back.
Okay. So far the total clients is currently 0. But since Theo has added me as his therapist, I will just refresh, and as you can see now, 1. So if I go to clients, I should be able to see Theo here because he has added me as his therapist. And whenever I click on him, I can actually see the same analytics he filled. So this is GAT7, the suicide risk assessment, smoking, marijuana, recreational drugs, and all of it.
All right. So that's just a little demonstration of what we've been able to build now. I'm happy to take any questions if you have any.
Hi. So in essence, is this specifically just for the assessment piece, but for the other days the clients aren't seeing the therapist?
Yes, so it's for assessment piece when the client is not currently seeing the therapist. So in between your assessments, you can select, I want my client to, I want them to do these assessments. And as we build in, we're also going to build the functionality of homework. If you have homework that you want to assign to your client, they can also do it through this means. And the idea is that, they have something that they can talk to because you're not always going to be there 24/7. You have something that you can talk to, something that can answer their questions, something that might be calming, having conversations with, and also doing assessment tests over time so that there's a measurement based to your care.
Thank you.
Yeah.
Jennifer?
Hi, I think this looks great. I just have a question about what would happen if, like, for example, a client takes the suicide risk assessment at like 1 o'clock in the morning and it shows that they're high risk. I'm wondering what the steps would be after that.
So our strategy is first, the goal is not to deal with emergencies. And so we're going to be upfront with the client that we're not dealing with. Our goal is not to deal with emergencies, and that they should call 911. I can show you an example of that. Maybe I should share my screen again.
Okay. Awesome. Because I definitely agree, and I hear you that people say like this is not for emergencies. I'm just thinking about in situations where if a client lonely, hopeless, don't want to talk to, this might be something that they would interact with.
It will tell them, to call the hotline for mental health. It'll also send you an email, but that's 1 o'clock in the night, so you're not probably going to see the email. But it does the same thing that any provider would do. It'll tell them to call the hotline, and that they should call emergency services. I want to kill myself. See, tells them to call a hotline, and then it leads them through the it gives them a form to fill. Would you like to talk to someone? Contact the crisis line. And then also takes them to do suicide risk assessment, and then it sends you an email so that you can check up on them when you wake up in the morning and say, have they actually gone through with the call? So the idea at the end of the day, you get an email like this that shows you all the things they answered. If this was a suicide risk assessment scale, you'd see the suicide, the questions and what answer they received on that.
Cool, thank you.
Yeah.
Okay, I have a question.
Yeah.
It might overlap a little with the last question. Is it a generic programming for how the chatbot responds based on what the client is typing in, or is it programmed with a client's background or with the state's background? Like if somebody does need crisis intervention, it says, should I email your therapist for me or make a phone call? Can it make a phone call to the local crisis intervention? So that's
right. It can't make a phone call right now. It's still a text-based application. Okay. Perhaps as we build more and we build a voice functionality, that would be something that's possible. But right now it's just text. So what it can do right now is email.
Okay, so all right, so it wouldn't email or text the local crisis intervention. It would email the therapist.
Yeah, but that's a good idea. Perhaps we can think about doing that too, because I think I'm always looking for ideas of better ways to serve. So I think that might be a better idea also, to email a local hotline. I wonder how many local places have direct email that they respond to. But
well, there are. What I do know is that there are several 911 type services now that do respond to text.
That do respond to text. Okay.
Yeah, it depends on which the locality. My other question is more of a comment concern. It looks it looks pretty good, except and also, by the way, my eyes are not. When you were doing your demonstration, I couldn't read it all, so very well but so I was listening. The assessment questions of having it be a adjunct to the therapy and getting assessment information, that all looks really great. But, the one comment that I'm not sure if I read it right when you were doing a demonstration, where the person said, I'm feeling hopeless or worthless. And the comment back was, well, something along the lines of, you shouldn't feel that way. Everybody's worth something. You know, it sounded more of, that would be concerning to me. And I'll tell you why.
Right.
You know, I don't mind the chatbot saying something like, oh, that's a shame that you're feeling that way. I think we should let your therapist know. You know, but to make a personal comment as if it's a person about the client when they don't personally know the client, could put the client off. You know, or, you know, if the client might stop and feel like, you know, it's like being placating or pacifying from a machine, and maybe the client realizes that and maybe they don't.
Right. Okay. That's wonderful feedback. One thing that we are working on right now is to allow people, you know, dislike a comment, so that if they don't like a comment, they can actually dislike it, and then we get information and see what comment that was, and maybe we need to, you know, restrict the
right. Yeah, but see, that might be a comment you get from a client, but maybe the client who's not feeling very well isn't going to be assertive enough to complain to a chatbot.
Thanks. That's true. Yeah. Yeah.
So that's my only comment, is to have your chatbot programming try to be avoidant of making personal comments.
All right. I'll look into that. Thank you very much, Lauren.
Okay.
Do we have any other questions or any comments?
I just wanted to say, like, I used to do some work with this thing called Pineapple Support, and it's kind of similar to that. And I do remember the client saying, like, they didn't like the generic comments that they were told back. But with Pineapple Support, they didn't really have, like, in the beginning, it wasn't like you had like a one-on-one therapist coupled with that.
Right.
So with this, I can see how, like, let's say if you're using it for assessment, how it could definitely be beneficial. And then if you do have something you want to follow up with your therapist, you can just like reach out to your therapist.
Right. And I also say that, you know, chatbot technology has improved a lot recently over the last few months. And so chatbots are definitely better at responding than they used to be, you know, almost a year ago. So I wonder how long ago it was that you were with Pineapple Support.
Yeah, that was like a year ago.
Right.
But what they would do is just have clients who just needed emergency help. It was for sex workers, but it was like if you just needed emergency help, you could chat, you know, the line.
Right.
But then if you didn't have a therapist, it did kind of feel like they were like left out to dry. But with this, I can see the benefit of coupling therapy with this measurement service.
I agree with you. This is not something that we can do. You know, people just talk to a computer and that's the end of it. There has to be an actual professional at the end of the line. So it can't just be, you know, talk to a computer and that's it. So when they see the therapist, because if it's within the context of a therapeutic relationship, they're going to see their therapist next week, and the therapist can look and see, okay, this is how you've been struggling, or you've been getting better, and that forms a context for that session. Thanks. I see that Frank wants to talk, but I'm not hearing you, Frank.
Sorry about that. Thank you, everyone. Yeah, my initial thoughts were to, I mean, it's still in its infancy stage right now, right? And right now, as I told Chinadu, we actually have Blueprint that's very, very like good, and we get all of our data, we get all of our stuff, right? We get all of our stuff on Blueprint, and they have dashboards. It alerts you, when they fill out the journals and things of that nature. My initial thought on this one was, as y'all probably know, I like the new technologies and to see where we were, but it was really for new clients, right? New clients and maybe emerging areas where we're just starting to expand. So a lot of y'all don't know, we were thinking about doing something in Africa, right? do I want to sit there and hire a therapist and then now the therapist goes and we don't have anyone, and it's a mess, right? Bringing on a new therapist, and then the first thing that every new therapist wants is, how many clients am I going to get, right? And so for this one, let's say in our emerging markets or our low served or underserved populations, it's really for like a lead generation to say, right now we have a lot of Psychology Today where they fill out that email. As an experiment, I'm saying, I wonder if I put this chat box there, A, would they use it? And B, can they have it there? Can we get more information? To then like Chinadu was saying, then to follow up later, right? More like, oh, this is like the beginning of your thing, type of thing. To use it anywhere else right now, is a very, very new technology. So, but that's that was my thought, is to use it. I wouldn't mind using this in Africa or underserved populations where we're trying to go, but we don't really have a lot of data, right? Or just to use, like I said, lead generation, new clients, bing, 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 bing. Hey, maybe you don't feel like filling out the form, or you don't feel like sending out an email, bing, 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 bing. And now the therapist, a lot of therapists, it's like, well, I don't really have a lot of information, right? Oh, I don't really know a lot when I first jump into there. Now, if you're able to see this initially, right, to say, oh, okay, their PHQ-9 is this or that, et cetera, et cetera.
Right.
Thoughts about that from anyone?
I think that's a very good use case. So when we thought about it, there were two use cases. Initially, before you see the therapist, and then longitudinal relationship, right? So before you see the therapist, that's a place, with it on the website, or maybe leading them to download the app and say, use this for the meantime till we get back to you. We have long wait lists, while you're on the wait list, you can talk to this, and when you get into to see a therapist, you eventually will have that context and information for you. That's one use case. The second use case is the longitudinal follow-up. So I'm excited to see, it's up to you guys. You are the therapists, you're the guys who need something, and it's whatever you need that we are looking to solve.
Yeah. So, and so we're thinking about it, right? We're thinking about it. We're trying to weigh the pros and cons. And I know that you all are very communicative on your thoughts. And definitely want to assess the risk, right? There's no need into going into unnecessary risk. And right now, this is not currently HIPAA compliant. Is that right?
Yeah, it should be HIPAA compliant by the end of this month. We are working on that.
End of June or July?
End of July, sorry.
Okay. All right. I don't even know if you can use it if it's not HIPAA, right? Go ahead.
Right. Yeah. My understanding is, when you talk about the lead generation piece, that's it's just like any customer service that can work. But then the longitudinal, that's where you have a problem.
Yeah. So maybe, as you said, very, very beginning stages. Any thoughts from anybody else? Like any other ethical considerations?
Okay. Stacy has raised her hand, so I don't want to get in the way, but I like your idea about intakes, Frank. I would hope if it's used in Africa or anywhere with intakes to help out, that maybe somebody is at least assigned an intake worker or a therapist as a backup. And then and I could see it used even within what we do now, where a therapist does an intake but doesn't get to everything, and say, because the client really wants to talk, or you go over the emotional stuff, then the therapist could say to the client, well, we didn't finish getting all the background information. There's this program going over the background information, so you could do it that way. If there's a waiting list and it's in Africa and they start with, and there's an overseer therapist that's assigned in case of emergency to review, then maybe the chatbot does the intake, but it red flags anybody that there's a problem with that intake. So anyway, I liked that idea. All right, Stacy, I know you had your hand up, so I didn't want to interfere.
No worries. I'm sorry. I'm losing my voice, so I'm trying to get it back. But I did have a question about the homework that you mentioned, like being able to give the clients homework through the chatbot. Could you show us what that would look like?
Yeah, that's the vision for the next phase. We haven't actually built it yet. So that's our next phase, because right now it just administers standardized questionnaires. So I can show you my rudimentary what we're building. Let me see if it's not shipping yet. Let's show you. So the idea is just to create kind of template like this, where therapists themselves can create their own homework, add their category. I would say, what is maybe PTSD, something like this. And then they add questions under that. So, you add a question, like, what homework did you want to talk about 5 things that made you thankful today, something like that. And they're able to save the question, and this becomes something that the chatbot can administer to the client. But it's still very early, but it's something that we're looking to do over the next month too.
Okay, thank you.
Yeah.
Quick question, Stacey. Are you currently using Blueprint?
No, I was gonna get with you after this to see how I get set up with that.
Gotcha. Okay. Yeah. Let's do a Blueprint training. Let me see. Any other questions before we'll let Chinny and the team go, and then we can talk internally as well. All right, Chinadu, Calvin, and Theo, thank you so much. We'll definitely schedule a follow-up. Do we have a schedule up followed? Let's follow up sometime tomorrow to get the feedback and to kind of discuss next steps.
Thank you so much. It's been really, really great talking to you guys. I'll send Frank an email. I'm happy to see the interest. I saw that lots of people were interested. And, this is just the beginning of great things. Thank you so much. You can reach out to me anytime. Maybe I can drop my email in the chat. I'm just going to drop my email in the chat. If you have any questions, just reach out to me. You can reach out to me on LinkedIn. I'm always there.
Great. Thank you so much. And Chinadu, he's actually from Canada. He actually lives in Canada. I think the rest of his team is in the UK as well.
Yes.
And so that's actually really exciting.
Thanks so much.
Thank you.
Yeah.
Blessings.
Yeah. Bye.
Thanks. Bye.
Thank you, Theo.